In May 2025, the Rotary Club of Sunrise, Florida co-hosted with LifePoint Church a community health seminar. And the LifePoint Church co-hosted this event because to them this is a ministry, as the core belief of the Judeo-Christian tradition is that we should love our neighbors as ourselves, even those neighbors who are different from us, and even those neighbors who are difficult to love. And Pastor Rob will share their homeless ministry and how they feed their homeless weekly at the church, and a ministry that distributes free clothes and other supplies to both orphans and the poor. Nareda Castillo, president of our Sunrise Rotary chapter, will share how the Rotary organization is addressing issues of mental health both locally and nationally. And this will include a discussion of a mental health program aimed at young people and students that has been developed by the Boston Children's Hospital, and we have a full-length video on this program. And our chapter also has a YouTube channel with many videos on mental health topics, plus many of our speakers on mental health and community outreach topics.
My name is Rob Morrow. I pastor this church, LifePoint Church, and I just want to say thank you, Rotary Club, for letting us partner with you. I will say this, when I listened to everybody on the list, that's what's coming through the church door every week. The church is still an organization that's free and it's open to the community. And we allow anyone to come in, and people are looking for help. And I believe this. It takes a community. It takes a village to heal someone. I don't know if you believe that. In the church, we can do our part, but I think if everybody does their part, we become a better community for people. And but it's good. I appreciate you guys sharing all your knowledge. A lot of that helps me to direct people to get the help they need. One of the things we offer here, we just started this about 2 years ago through the USDA, is we do food distribution. So if you know anybody that needs food, every Wednesday at 9 a.m., just come to the parking lot. We feed 350 families a week right now. You just basically drive up. There's no questions asked. You will have to sign a form. It's usually about 4 days worth of groceries. It's not like old, out-of-date food. It's brand new, great, good food. So we've been doing that for a couple of years. So if you know somebody that needs that, more than welcome to come to that. We have another organization that we just opened about a year ago. It's called Echo Ministries. What we do is we partner with businesses in Broward, but it's a consignment shop. I heard somebody mention it earlier about the adoption, but if you're a relative caregiver, so if you're a grandparent raising a grandchild or an aunt raising your nephew, you can come to the store, the shop, and get free clothes, free haircuts, free shoes, anything tangible that you may need to help raise that child, we'll get it for you. Not a car yet. We're going to do a car one day, I promise you. But right now, mainly it's clothes, shoes, and listen, we do not take donated items unless it's brand new, because we just know some of those kids and families have been traumatized a lot, and so we just try to give the best we can. But there's a lot of grandparents that come to us that are raising their grandkids, and they come and get, and if you come if you come on Wednesday, you can make an appointment to get the hair done the next time they come. And we have a team of ladies that volunteer that as well. But listen, our doors are open here at LifePoint Church, Rotary Club. Thank you for letting us partner with you. And we'd love to have you visit our Sunday services. I'll just let you know. You can get the information at the desk, but we do 9 o'clock and 10:45 every Sunday morning. And then we do Spanish service at 12:30. And then Wednesday night we have classes and a service, and we're bilingual on Wednesday night. So we'd love to have you come out and shake our hand and greet us. Yes, ma'am. We have a youth group, thank you, that meets on Friday nights. So that's the youth group would be 13 to 18, 13-year-olds, 18-year-olds. They meet here. They have the whole building to themselves on Friday nights now. It's pretty crazy. And then on Wednesday nights, every age has its own class. That's gender and age-wise. I'm not going to go through them right now because I don't even know what they all are. If you're in the nursery or 99, we got something for you. That's what we know from a classroom, a Bible study, things like that. So we try to make sure we can, minister to the whole family when someone comes here. We even have a seniors group. They meet and do Bible study and things. They meet once a month. Sometimes they do like a lunch here, just kind of a group to do things like that. But hey, come visit us one Sunday. We love this community, and it's been a great day so far, right?
Rotary International has been recognized as a platinum level sponsor by the Alzheimer's Association. This prestigious acknowledgement is a testament to the incredible impact our members have made. Last year, we raised over $500,000, and we're committed to matching or exceeding this amount in the upcoming Walk to End Alzheimer's. In October 1995, the Sumter Rotary Club in South Carolina, led by Roger Ackerman and Dr. Jack Bevan, initiated the effort to prove that Rotarians voluntarily emptying their pockets and purses of spare change into little blue buckets for a good cause could produce significant levels of funds to support the Alzheimer's disease research. The CART Fund, which stands for Coins for Alzheimer's Research Trust, was the name given to this project. The CART Fund is supported by more than 600 Rotary clubs in 40 districts. It has awarded more than $13 million in research grants to 60 plus different research institutions in the US. If you see on your tables, there's a little blue bucket where you can donate your coins for Alzheimer's research. Our club is taking a significant step in this fight by participating in the Walk to End Alzheimer's at Nova University. We invite you to join us, walk alongside us, or support our team with a donation. Every step, every dollar, and every voice matters in our collective quest to end Alzheimer's. Support our team and contribute to the Alzheimer's Association research and care efforts. Mental health is just as important as physical health, and it's essential to prioritize it. It's okay not to be okay, sorry. But there are many of us suffering in silence. Silence is not the answer. Keeping things bottled up inside only leads to negative outcomes. Mass shootings in schools, heightened anxiety due to society's pressures, depression that leads to suicide. In 2023, Rotary International's President Gordon McAnally created an initiative focused on creating hope in the world by addressing mental health issues. This initiative was called Creating Hope in the World. Hope is a powerful tool in mental health. When we have hope, we feel more empowered to tackle challenges and overcome obstacles. President McAnally's initiative aimed to create hope in communities worldwide by promoting mental health awareness and support. Since mental health was such an important topic, Rotary International created an action group called RAGME, the Rotary Action Group on Mental Health Initiatives. It is comprised of a group of Rotary members working together to address mental health issues globally. Their mission is to break the stigma, raise awareness, and increase the capacity for treatment and prevention of mental health conditions. Through the help of this action group, Rotary clubs around the world have come up with programs on mental health. There's the Wellness in a Box.
Now, we recently had Bob Anthony from the Naples, Florida Rotary chapter speak about a program promoted by Rotary, which was developed by the mental health professionals at Boston Children's Hospital to improve mental health for children. Bob is a member of the Rotary Action Group on Mental Health, and the questions and answers in the main video are particularly informative on practical advice on how to implement this program and how to present it to physicians and hospitals. Now, the goal of the program is to treat symptoms of children's mental health early so they can live a long and healthy life. And how to achieve this goal: enable the pediatric primary care practitioner to manage all moderate cases in collaboration with the behavioral health specialist when available. The program includes 3 core components: self-based, web-based training on the most common mental health conditions of youth, like anxiety, depression, and ADHD, ongoing consultation support from medical teams, and guided self-management toolkits for the patient and parent. The training for prescribers and patient self-management tools to overcome implementation barriers such as clinician time constraints, productivity expectations, and it also improves revenue through additional billing codes and billing strategies that enhance care. So in other words, the pediatrician can both run a more efficient practice and help more of his young patients with their mental health needs. And it enables primary care pediatricians to stay involved after they refer patients to specialists. And also, counselors, schools, and families can download the guided self-management toolkits for families so everyone's on the same page. There are multiple toolkits available for whatever needs the youth has.
One of the most challenging things about being a parent is just finding the balance. I have 5 daughters. They're all different. What might work for one might not work for the other. It's just hard. My kids have a big trauma in their life. My child's father passed away. When she was little, a teacher told us, she doesn't look at us in the eyes. She wouldn't sit still. In kindergarten, she couldn't pay attention. So we did see some things in Gianna, just like we saw in Micaela, but a lot more came out once their dad passed away. It just became even more difficult.
I had a really hard time with math. The way they explained things to me was really confusing, and I just couldn't understand anything. Reading was a struggle, and I couldn't read any of the packets or anything of the instructions. So it was really hard to read and write.
My anxiety was really bad, and I had panic attacks multiple times a day, every single day. That was probably the hardest point in my life. I just felt like everything was crumbling in on me.
It's hard. It's very hard. I felt like I was drowning, but even worse, she felt like she was drowning. And I didn't know how to get her out of there. So I came to my doctor's office to ask for help. I met with Dr. Anzalone and Dr. Tam, and then I was introduced to the toolkit.
One of the things that we focus on in our clinic is teaching basic coping skills, and one of the very helpful resources has been using the toolkits from Boston Children's Hospital. They teach small, evidence-based ways to reduce anxiety, reduce depression, and manage behavior in general. And through teaching those skills, one, you can help individuals with all levels of severity, and it also keeps people from having unnecessary treatment, time, and costs.
To have it organized in a way that you can actually focus on each child's issue and have an ability to be able to manage each child personally and in a way that it's going to be meaningful for that child's issue is going to help her, because it can be overwhelming. But when we can give people the ability to organize it in a way that makes their lives easier and bless their children in a way that they can heal, empowers her.
When I read it, it just all clicked. It's kind of like, wow, I'm not the only one that's going through this. I'm not crazy. My kids aren't crazy. There's people that understand and other people that are going through the same things that I'm going through. So it helped me.
It's amazing, honestly, what these toolkits can do. If you just read some of the information, it makes a lot of sense. It felt great. It made me feel better. I'm definitely doing a lot better these days than I was before. It was great.
Today, the girls are doing good. They're much better. Every day we're still working on stuff, but much, much better. The girls have improved a lot. If you're a parent wrestling with this, I've been in your shoes. Read it, give it a try, and it works.
And there's also a webpage for the Rotarian Mental Health Initiatives Action Group. And the Rotary Club of Sunrise, Florida has a YouTube channel with many videos on many of our speakers, plus topics on mental health.
So our organization is proud to participate in the NAMI Walks. It's a nationwide event series that brings together thousands of supporters to share their stories, build community, and work and walk together to achieve mental health for all. NAMI is a beacon of hope for millions of Americans affected by mental health conditions. Through their award-winning programs like NAMI Walks, NAMI in Your Own Voice, and NAMI Ending the Silence, they're making a tangible difference in people's lives. This year's NAMI Walk will take place at the Nova Southeastern University on October 4th. So autism spectrum disorders, ASD, it's a developmental disease that affects communication, social interaction, and behavior. Families of children with autism often face social stigma, lack of understanding, and limited access to resources. Rotary clubs around the world are taking steps to increase awareness and support for individuals with autism. We have events like the Sunshine Rally and the Champions of Inclusion Gala to promote inclusion and awareness, providing vocational training programs for youth with autism, organizing art workshops and music therapy sessions, advocating for acceptance and integration of people with special needs into society, and also providing support to organizations such as the Careño Foundation, LifePoint Church, and others that are resources for and assist people with disabilities and other life challenges. So I ask you, what can you do today to create hope in the world? Share your thoughts and ideas with us. Visit our club and get more involved in your community and help spread awareness. Starting in July, we'll be meeting on the second and fourth Mondays at Wings in Weston. You can also find our website and learn more about our club and what we do in the community, www.rotaryclubofsunriseflorida.org. And finally, we want to give a heartfelt thank you to LifePoint Church, Florida Blue, Humana, and Hooters for their generous sponsorship of our seminar. The Rotary Club of Sunrise, Florida is incredibly grateful for their generous support of our initiative. We're excited to bring together experts and community members to discuss important topics like dementia, autism, and mental health. Thanks to their support, we can work together to make a positive impact. And let's work towards promoting awareness and support in our community.
If you are in Sunrise, Florida, please visit our club. You can find the meeting times on our club website. I have a video on the history of Rotary and my personal goals in joining Rotary. What is Rotary? We have a short video that we downloaded from the Rotary International website that explains the many goals of Rotary International.